This is the BestHealth Podcast, brought to you by Wake Forest Baptist Health in partnership with MedCost.
Good day, everyone. Welcome back to the latest BestHealth Podcast, brought to you by Wake Forest Baptist Health. Justin Gomez here. Glad you're joining us for another episode. We've had a lot of BestHealth Podcast episodes lately involve the topic of COVID and coronavirus, and we will be talking about COVID again for this session, but in a slightly different light and from a different angle. And I think it'll be really interesting and enjoyable for y'all to learn something about the different research aspects of COVID and how Wake Forest Baptist Health is involved in those. So to help me explain that better, much better than I could, I have a great guest with us today, Dr. Allison Mathews. How are you doing?
I'm great. How are you? Thank you for having me.
Yeah, absolutely. So glad you could join us. And I'm going to get into a great conversation with Dr. Mathews in just a minute. But as I do with other podcasts that are talking about COVID, I do want to make everyone aware that is listening that our COVID hotline is still active 24/7. If anyone has any questions about the virus and symptoms and where respiratory assessment centers are, or any other questions, you can call 336-70-COVID, or you can visit our website at wakehealth.edu/coronavirus. There's all kinds of information there and best practices on how to wear a mask and information about children and COVID, especially with this kind of back to school season that we're in right now. So invite everyone to go to that website and check out the information. So as I said earlier, Dr. Mathews is joining us, and Dr. Mathews is actually with our Maya Angelou Center for Health Equity. And we're going to talk about exactly what that is here in a second. But before we do, Dr. Mathews, tell us a little bit about yourself, how long you've been with Wake Forest Baptist, and how you got in this field that you're working in today.
Sure. So I am originally from Dallas, Texas. I moved to North Carolina after finishing my degree at Howard University in sociology, and got a PhD in sociology at UNC Chapel Hill. And I've always been interested in questions around equity and discrimination and addressing stigma, and how we can, as a community, find ways to overcome those things. How do we cope with them? How do issues around race and gender and income and documentation status, how do those things impact our lives, and how do we cope with them? And so a lot of those questions that I had, in my research and the interest in the work that I had, kind of lent itself to clinical research engagement. In the past, I've worked a lot on HIV work, trying to find prevention, treatment, medications, and also working to find a cure for HIV. And I worked with the HIV Cure Center at UNC Chapel Hill. And so that's when I really fell in love with doing community engagement around clinical trials, just thinking about this idea of involving community members at the very beginning of a trial, or even before a trial even starts, and empowering them to have their voice heard, and on how the design of the trial happens, how people can improve recruitment and retention of those trials, how we can protect participants, how we can address the concerns of the community around, the ethics of these trials, and making sure that they benefit the community, and making it more kind of a mutually beneficial relationship rather than it being top down. I just got really passionate about that work, and it brought me to Wake Forest. Once I finished my training at UNC, it brought me to Wake Forest, where I'm associate director of integrating special populations, which is basically all of the things that I said.
Okay. Well, we're glad that you came over from that Tar Heel Blues to the black and gold at Wake Forest.
Yeah.
So that's a great segue, actually, kind of the description you were giving a second ago. You are work over at the Maya Angelou Center for Health Equity here at Wake Forest Baptist. There's some people listening that might not know exactly what that center is or what it does or how it benefits the community. So if you want to take just a quick second and tell us a little bit about the Maya Angelou Center and the good work that is happening there and what the purpose of it is and how y'all are making a difference.
Sure. The Maya Angelou Center for Health Equity has been at Wake Forest, I think, for the past 12 or 13 years.
Mm-hmm.
However, it was a 3-person show. It was a very small center. And then when Dr. Bird, who's the current center director, was recruited and brought to Wake Forest, she had a vision for a much bigger center and a much bigger impact. And so since she has been on board, we've actually tripled our staff. There's about 12 of us now on staff, and we work with the American Indian population. We actually have the North Carolina American Indian Health Board that's housed within the Maya Angelou Center. We work with older adults around caregiving and Alzheimer's and dementia. And then I brought my work around HIV engagement and kind of connecting people to care. Mm-hmm. And then we have the Integrating Special Populations program that works with the university and researchers to help them better engage the community and improve recruitment and retention of underrepresented groups into clinical trials. So a lot of our work is around educating people, increasing access to resources, building out networks, creating educational material, and doing research on health equity.
All right, that's a great overview. There's great information and community collaboration that is anchored over at the Maya Angelou Center that I've seen since I've been here at the medical center, and y'all are doing great work. So I applaud Dr. Bird for being able to grow the team over there, and y'all just keep on keeping on because you're doing really good stuff.
Thanks.
One thing that obviously is on a lot of people's mind lately is COVID. So, I know part of Wake Forest Baptist Health, the organization as a whole, one of our 3 core missions is research. And on any given week, we're involved in hundreds, at least, of different studies. But during this time of COVID, all the COVID-related studies have bubbled up to the top from a national media perspective, from a social media perspective, lots of information floating around. And at Wake Forest Baptist Health, we are involved in a number of COVID-related studies as well. And I know we want to talk about a couple different studies and then have you answer some questions about those studies, and then maybe at the end talk about how people can get involved. So the first one I want to talk about is the COVID-19 Community Research Partnership. And you all have been working very hard on this and linking different segments of the community into this study. And it's a COVID antibody study. It's based around the antibodies of COVID, correct?
Yeah, well, before I jump into that, I think it's important. Part of the reason why Maya Angelou Center got involved in any of this COVID-related work is because we have the goal of being a trusted source and building trust between community members and the research institution, right? Historically, especially in Winston-Salem, but this is true across the world. Research has not always had the best reputation in our communities, and especially among vulnerable populations. And even the reason why we have an Integrating Special Populations program is because there's not a lot of trust in the community. And so we got involved with the COVID-19 Community Research Partnership. The title itself, right? You're supposed to be in partnership with community. Yeah. We wanted to make sure that we could help bridge that gap and create that trust and build that relationship between community members and the research to make sure that it's mutually beneficial.
Sure.
So the community research partnership, the goal of it is to have people track their symptoms on a daily basis, and any kind of potential exposure to COVID-19. And then a subset of the population of participants would receive a home test kit once a month where they could test themselves for antibodies for COVID-19. And the reason why we have both of those segments of the study is to understand if someone is experiencing symptoms, or if anyone is experiencing symptoms. If they're not, also, have they been exposed to COVID-19? How is it affecting their body, right? And it's connected to their medical records, so then we can see if there's any kind of prior health conditions that can inform our understanding of how COVID-19 is impacting people's bodies. As well as thinking about, community spread. A lot of people hear about that, or herd immunity, these things. How do we know that, and how long the antibody protects someone from COVID-19, if at all, at any point, right? And so this study does help us answer some of those questions. And the way that we've really tried to partner with community in that, in addition to just having people participate, is working with minority vendors and small businesses in Winston-Salem, so that they're producing the T-shirts and the hand sanitizer and the masks and the flyers and making it beneficial. And then we've purchased 1,000 phones that we are in the process of distributing to community members who don't have access to the internet and could otherwise not be able to participate.
Wow.
So those are really it's an impact, it's a benefit, and we're trying to make a sustainable benefit, not just, we want to make sure that it has a lasting effect in the community with the study.
Yeah, that makes great sense. That's great information, Dr. Mathews. To follow up on that, so looking at kind of how the actual research study, if someone might be interested, might not be interested, but they want to learn more about it, they can go, obviously to the website and learn more. We'll give that information at the end. But so I guess if you're at a community event and you start talking to someone and they're like, hey, I might be interested in this, what's some of the important key factors that you let them know on how they can, what happens when they're in the study? Maybe to some people, kind of being part of a research study might sound kind of scary. There might be some unknowns they're unsure about. So when you're talking to people and helping put their mind at ease, what are some of the things that you're talking to them about?
Well, I would have to emphasize the fact that currently we're only enrolling people who have been a patient at Wake Forest Baptist Health. Okay. So we try to encourage people, even if you've never been a patient at Wake Forest Baptist Health. We've actually been working with the mobile unit that goes out into the community 4 or 5 days a week and provides primary care services for uninsured patients and for Spanish-speaking population. So that, that's one way that people, if they have never been a patient, they could become a patient and enroll in the study. Yeah. But usually when I'm out in the community, I say, hey, there's a study where we can, we want to better understand how COVID is impacting our bodies and our communities. And so this is a way for us to do that by tracking your symptoms and your exposure on a daily basis. And then a subset could get a home antibody test kit. That's a benefit because a lot of people are struggling to figure out where to go get tested and how to get tested. And so even though, but also I want to make it clear that the antibody test does not necessarily detect an active virus. Sure. But it does tell you if you've ever been exposed to coronavirus and been infected with coronavirus in the past.
Gotcha. So the daily check-in is web or phone-based, and hence the availability of some phones you're providing to the community. If they don't necessarily have access, you might be able to help them with one of the phones that you all have that you're helping coordinate, right?
Yes. And so with the phones, we're also helping people set up email accounts and kind of showing them how to use the phones, and we're paying for a small data plan for them. And then for people who do have phones, they can either track their symptoms through an email that they get on a daily basis or through the Sneeze app, which is
Okay.
pretty
Yeah. I have downloaded the Sneeze app on my phone last flu season to kind of keep track of where flu was around the community.
Yeah.
Now, of course, when Wake Forest Baptist Health is based in Winston-Salem, but we have multiple hospitals across the region, and we have patients from all over. So just to clarify, someone doesn't have to live in Winston or Forsyth County to participate in the study, correct?
That is correct.
Okay,
No.
good. So to move on, I guess so we're collecting all this data, and the scientists are examining this data and hoping to find some sort of trend lines, or not find trend lines where they thought maybe there would be some, to help better understand COVID. Maybe talk a little bit about how this would be beneficial to the community, how having a more inclusive participation and the findings that are coming in, how this would benefit the community.
Well, like I said, it's sponsoring local businesses, trying to put money back into the community. We're in the process of employing people, right? So a lot of this money goes towards providing jobs. We've also helped work with the Forsyth County Department of Public Health and the Hispanic League, Forsyth Tech, Hustle Winston-Salem, the 20, Northeast Winston Neighborhood Association, like all of these different, Love Out Loud, Second Harvest Food Bank, all of these organizations we've been collaborating with and kind of try to coordinate. We actually have also started a community leadership council, which Dustin, you're a part of. That also kind of allows us to get community feedback on better ways to engage with the public. So we've given out, I don't know, maybe 2,000 bottles of hand sanitizer, over 2,000, maybe 3,000 or more masks. We've given out information about coronavirus. So even if people aren't participating in the study, there's other benefits. And then we also try to, make sure that we are as transparent as possible in reporting back the information that we find from the study, the findings from the study. So you could actually go to wakehealth.edu/COVID-19 community study, and there's a data page that shows, the latest findings on where people have antibodies for COVID-19 and maps that onto active COVID-19 infections. So that also is like information that we're trying to make available on a regular basis so that people can make more informed decisions about their health.
That's a great point. Yeah, there's some really interesting data and results available on that page that you referenced. Would you want to just talk briefly about, based on what you've heard and what you've seen, what we've learned so far from the community study, the community partnership?
Well, there's a couple of things. One is that the majority of people who have participated in the study, we've learned that they have not had any symptoms and didn't know that they had ever been exposed to someone with coronavirus, yet tested positive for antibodies. There was about 6% of the total population of people who participated in the study have tested positive for antibodies. And that is a fairly high number. That doesn't sound like a lot, but that is a lot of people. And so that's one major thing that we've learned. We're a couple of months in, so there's some other information that I'm not sure we necessarily have full conclusions on yet, but we're able to also kind of over time, we're going to be looking to see if someone has an antibody for COVID-19, what effect does that have on your long-term health? Like, even if you didn't have symptoms, like we kind of already know people who have symptoms, you know, it has a certain effect on your health, and it affects your lungs and your heart and that kind of thing.
Yeah.
What about people who don't have symptoms and they've been exposed to coronavirus? Does that have impact on their health? We don't know that yet. And so that's what we're going to learn in future from this study.
That's so fascinating. There's so much, you know, that we still don't know about this, and so much to learn. So I think what y'all are doing with the Maya Angelou Center and working in tandem with the scientists doing the research, you know, to make the people as representative as possible of the population, general population, be the representative of the study group, I think is important. So I think, you know, I hope that people are listening and receiving what y'all are saying very well, and you continue to do what you're doing. I did want to transition from the Community Research Partnership antibody study to, I think what has maybe been in the national media, a lot of people talking about lately are vaccine studies. You know, vaccine study, when are we going to get a vaccine? We need a vaccine. You know, every day on the news, there's probably something about vaccines. So to that end, Wake Forest Baptist Health is participating in one of the vaccine trials. And I wanted you to talk a little bit about that, kind of where we are in that process, how Wake Forest Baptist is involved, and what all it entails to be in the study. What would someone have to do if they were in the study?
Yeah, so the COVID-19 vaccine study is a phase 3 trial, which I think is important to note. And so a phase 3 trial is a phase where they have already studied the vaccine in animals, and they've already studied it in a small sample, small meaning 600 people, sample of humans, healthy humans. And from those studies, we have found that the vaccine is safe for humans and has minimal side effects. So the side effects are fever, fatigue, pain at the injection site, and chills, and a headache. And so but those symptoms only last for a couple of days, and then they're gone. And they've also found that the vaccine produces a better immune response, like by producing antibodies in the body, than if someone were to have been infected with COVID-19 and have antibodies. So the vaccine helps teach the body to recognize the proteins of COVID-19 and fight it off. So we have begun enrollment with that study, and patients are compensated for all of their visits. And if people need help with transportation, they're able to provide that. The goal is, of course, to enroll people who are at the highest risk for COVID-19. So that includes healthcare workers, older adults, African-American and Latinx community members, as well as people who have underlying health conditions. So, we want to understand how well does the vaccine work in populations that are at the highest risk. So that's more of the phase 3 stage of the clinical trials. We have enrolled 70 people so far within, I think, within a week. And there's we want to make sure that we have diverse participation. I think there's been some things in the news, especially from Dr. Tony Fauci, who's the director of the National Institute of Allergy and Infectious Disease,
Mm-hmm.
who has really been adamant about advocating for representation of Latinx and African American community members in these
Mm-hmm.
trials, because we want to make sure that the vaccines are reflective of our bodies and our experiences, and that we are reflected in the research, so that when they're developing these vaccines for market, that they are accessible to us and reflect our experiences.
Gotcha. So if someone is interested in participating in the vaccine study, how long of a commitment are they making? Is it just, I come in, get one vaccine and I'm done, and then I have to see y'all again, or kind of what's the process with that?
Well, so the process is that I think the first visit is the longest visit. You would come in, receive the vaccine through an injection. They would monitor you for safety. And then you come in, I don't remember, I think it's once a month. After that, you would come in once a month, and they would do some blood work and do additional testing to see how it's affected you, and if you have any side effects, and how well you're producing antibodies. They closely monitor you, so if there were any adverse event, they would immediately stop it. And they are interested in, if you do get COVID-19, that would be an indication that the vaccine is not working. So they would also want to know that, right? The study lasts for 2 years, it's, we're trying to make sure that anybody, if you need any kind of support, say it's, you need, the clinic is open from 7 a.m. to 4 p.m. But if you need kind of flexibility on those visit times, then they can work around that for you. If you need access to transportation, they can help you with that. If you need help navigating the hospital, they'll help you with that. So we're just trying to make every effort to make sure that people are supported in this process. And you also will be tested for COVID-19. And we have a lab on site to be able to give you the results for the COVID-19 test within a short amount of time.
Okay, well, that is definitely beneficial as well. Well, I think, Dr. Mathews, it's been great having you on this podcast episode talking about COVID-19 and some of the research that's going on here locally in our area, and that actually people who live in this area around North Carolina can actually participate in any of these studies. And, hopefully people listening have learned about what we're doing to try and help as far as combat COVID, and how Wake Forest Baptist Health and the Maya Angelou Center for Health Equity are participating in this effort. So thank you for your time. I really appreciated talking with you today. So thanks for joining us.
Thank you. And I would just say, if anybody's interested in participating in the COVID-19 vaccine study, they can email COVID-19 vaccine study wakehealth.edu and express interest. And if you want to learn more information about what Maya Angelou Center for Health Equity is doing, you can follow us on Facebook, Instagram, and Twitter. All the same handle, WFMACHE.
Okay. WFMACHE.
Yes.
Awesome. And if people are interested in learning more about the community research study or some of the data and the results, can you give that website URL one more time?
Sure. It's wakehealth.edu/COVID-19 community study.
Okay, cool. Well, we'll definitely share that information on the podcast page as well. And once again, it's been great talking with you. And as we get, I guess, further down the road, a few months from now, and we're learning more about the results of the study episode and talk about where we are as far as a results and data updates, I think that'd be really interesting.
That'd be awesome. Thank you so much.
All right. Well, you have a good rest of your day, and everyone out there listening in podcast land, thank you for taking the time to listen to today about the COVID research opportunities. And just generally, as we wrap up, want to offer the overall COVID URL again. It's wakehealth.edu/COVID if you have just general information about COVID, or you can call 336-70-COVID. So everyone listening out there, I hope you guys are doing well. And until we talk next time, please be well.
Thanks for listening to this episode of the Best Health Podcast, brought to you by Wake Forest Baptist Health. For more wellness info, check out wakehealth.edu/besthealth and follow us on social media. Wake Forest Baptist Health. Care for life.